my name is Kirsten Wagner. I'm a clinician here at Bellevue Physical Therapy at the Papillion location. Today I'm going to take you through 2 exercises that you may have been given for your home exercise program. The first exercise is a posterior pelvic tilt, and the second exercise is more of a bracing your core in a neutral spine, working on activating that transverse abdominis muscle. So let's get started. Go ahead and lie down on your back, either on the floor or yoga mat. Maybe you do these exercises in bed. Wherever your place is at home to do your exercises, let's get you in that position. We're gonna start with the posterior pelvic tilt. Laying on your back, I want you to just pay attention to your body positioning. Go ahead and make sure both knees are bent as well. Feet are on either the table, bed, the floor. And I want you to pay attention to how your spine is sitting in this position. You might feel a little bit of an arch here at your low back where your back isn't necessarily touching the table. So with our posterior pelvic tilt, we're gonna think about the pelvis here. Think about rocking that backwards and flattening our back to the table. Something that's particularly helpful is putting a hand under there and trying to push into your hand. Or without the hand, you can just think about drawing your belly button into the table or into the surface that you're laying on. Think about pulling that belly button towards the table and flattening your whole back to that surface. Try and hold this as long as you can, and then rest. You probably have a set amount of reps and sets your therapist wants you to complete, but overall here, I really want you to think about the form and what muscles you're feeling doing the work. So, a lot of times we're just trying to get the right motion. You might feel your hamstrings firing back here. You might feel your butt muscles kicking in a little, those glute muscles trying to help you with this. I want you to try and get that to be mostly a core movement. So I want you to think about those core muscles here, really emphasize the lower abdominals, those stomach muscles, to pull that belly button towards the table, floor, bed, and hold, okay? So that's our first one, that posterior pelvic tilt. You'll notice too, you can probably see my hips in the video, how they're rocking backwards. So my pelvis sitting here, I'm gonna pull it under. Another thing that might help you get the right motion here is if you had a tail, think about tucking your tail underneath you and really just feel those hips rock back towards the table. Okay, let's move on to the second exercise. This one is a brace in neutral or in a spinal neutral. So I want you to find where your spine feels comfortable. So for me, when I just kind of relax, find my neutral position, everybody's neutral is probably going to be a little bit different. Find your neutral position. For me, there is a little arch at my low back there. Now, instead of pulling my back to the table, moving my pelvis, we're just gonna work on activating our core and bracing in this neutral spine. So I don't want your back to move in this one or your pelvis to move. I want you to just turn on some of these core muscles. So the muscle we're going for is called the transverse abdominis muscle. And I like to try and put my fingers in that area so that I can feel if I'm getting it. So you're gonna find your front hip bones here. And then I want you to move just a little bit inward towards your belly button and a little bit up as well. So let me sit up and show you on here. I'm gonna find my hip bones here and I'm moving just in and maybe even a little up as well. So I'm gonna palpate on either side here. So I'm gonna get my fingers in that position, find my neutral spine, and I'm just gonna try and stiffen my tummy muscles there and relax. And I'm gonna stiffen and hold. Try and take small breaths if I can. If I try and take a deep breath, I'm gonna lose that core brace. But one thing you can think about is taking a deep breath in and then blowing out like you're trying to blow out a candle pretty fast and like forceful. So you could go, you might feel those pop there. If you were to cough or something, these are the muscles you would feel kind of poking, stiffen under your fingers, I guess. One other thing you might think about is if somebody was gonna come and poke you in the ribs, kind of how you would tense your muscles in preparation for that. So that's what we're aiming for there. You might notice you're getting some upper core activation as well. That's fine. What we're really trying to engage is this lower core. So try and focus it there if you can. Give these 2 exercises a try at home and let us know how it goes.